Welcome to This Week in Orthopedics. This week we're covering 9 notable papers spanning long-term outcomes in joint reconstruction, biological and metabolic enhancements in sports medicine, and critical complication profiles in hip and knee arthroplasty. Let's dive in. We begin with total knee arthroplasty, where optimizing implant alignment to achieve soft tissue balance remains a primary surgical goal. The journal Knee Surgery, Sports Traumatology Arthroscopy published a prospective cohort study of 400 patients undergoing robotic-assisted total knee arthroplasty to evaluate 4 distinct alignment strategies. The investigators utilized robotic data to intraoperatively analyze mechanical, kinematic, functional, and patient-specific alignment. They discovered that a tibia-first gap-balanced patient-specific alignment achieved an optimal ligament balance in 98% of cases. In contrast, standard mechanical alignment achieved balance in only 17% of knees, kinematic alignment in 38%, and functional alignment in 29%. Even when considering potentially correctable cases, the overall balancing rate for patient-specific alignment remained at 98%, vastly outperforming mechanical alignment at 50% and kinematic alignment at 49%. These findings suggest that a customized patient-specific alignment workflow is highly superior for achieving intraoperative ligament balance. Once the implant is aligned, the long-term clinical and economic consequences of our surgical choices unfold over decades. The Lancet published a large-scale pragmatic multi-center randomized controlled trial with an extraordinary 20-year follow-up, comparing patellar resurfacing against no resurfacing in over 1,700 primary total knee replacements. Over the 20-year period, there was no statistically significant difference in the primary outcome, which was the Oxford knee score, or in other major clinical endpoints. However, the patellar resurfacing group accumulated significantly more quality-adjusted life years, with a mean of over 7.2 years compared to under 6.9 years in the non-resurfaced group. Furthermore, the overall 20-year healthcare costs per participant were nearly identical between the groups, as the slightly higher initial cost of the primary procedure with resurfacing was offset by lower subsequent readmission costs. Ultimately, the resurfacing strategy demonstrated a 99% probability of being cost-effective, leading the authors to conclude that the evidence is weighted toward patellar resurfacing as the preferred first choice. To better understand how we quantify these joint replacement outcomes, a study in the Journal of Bone and Joint Surgery established clear clinical improvement thresholds for the Oxford hip and knee scores based on patient satisfaction. Analyzing over 1,400 total hip replacements and 1,000 total knee replacements, researchers identified that a post-operative Oxford hip score of 35.5 represents the minimal clinically important difference, while a score of 36.5 represents a substantial clinical benefit. For the Oxford knee score, the minimal clinically important difference was 30.5, and the substantial clinical benefit threshold was 38.5. Interestingly, preoperative scores were poor predictors of postoperative satisfaction, and patients with worse preoperative function actually required higher postoperative scores to feel satisfied. These objective thresholds offer valuable benchmarks for value-based healthcare policies and clinical decision-making. While we strive for excellent long-term outcomes, early catastrophic failures remain a major clinical challenge. Another study in the Journal of Bone and Joint Surgery highlighted the alarmingly high complication rates associated with early periprosthetic femoral fractures occurring within 30 days of primary total hip arthroplasty. Utilizing a large national database, researchers compared these early fracture patients to those who fractured later or had no fracture. Patients with a fracture within 30 days of their primary surgery had significantly higher 90-day complication rates and dramatically lower 2-year survivorship free of refracture, infection, and reoperation. In fact, their 2-year survivorship free of reoperation was only 48.5%, compared to over 97% for those who did not sustain a fracture. This underscores the critical importance of aggressive fracture prevention strategies and close surveillance for patients sustaining early postoperative fractures. Transitioning to sports medicine and joint preservation, biological and metabolic optimization are emerging as powerful tools to improve healing. A prospective randomized triple-blinded phase 2 trial. By analyzing circulating microRNAs, the researchers found that zoledronic acid significantly altered expression profiles related to inflammation, fibrosis, and collagen synthesis. Specifically, 2 days postoperatively, patients receiving zoledronic acid had significantly lower levels of microRNA 143p and the molecular pathways impacted suggested decreased inflammation at the enthesis alongside increased collagen synthesis and vascularization. This provides a clear molecular rationale for why systemic zoledronic acid may improve tendon-to-bone healing and reduce postoperative re-tear rates. Beyond pharmacological bone-active agents, systemic metabolic management is also showing unexpected benefits in rotator cuff outcomes. A retrospective database study in arthroscopy evaluated the impact of preoperative glucagon-like peptide-1 receptor agonist use in obese patients undergoing arthroscopic rotator cuff repair. After propensity score matching over 1,100 patients in each cohort, the researchers found that preoperative use of these metabolic agents did not increase 90-day medical complications. Remarkably, at 1 and 2 years postoperatively, patients using these receptor agonists had significantly lower revision rates for left-sided repairs. Furthermore, female patients using the medication had roughly half the rate of re-tears at both 1 and 2 years. This suggests that managing metabolic health preoperatively in obese patients may directly translate to superior structural outcomes after tendon repair. However, not all biological augmentations yield positive results. A randomized controlled trial of 175 cases. Sports traumatology arthroscopy evaluated whether adding platelet-rich plasma or bone marrow aspirate concentrate to a quadruple autograft during anterior cruciate ligament reconstruction improved outcomes. At a 2-year follow-up, there were no clinically or radiologically significant differences in patient-reported outcomes, activity scales, or graft signal intensity on MRI between the biological groups and the control group. In fact, patients who received bone marrow aspirate concentrate showed poorer signal intensity on MRI. These findings suggest that routine biological enhancement with platelet-rich plasma or bone marrow aspirate concentrate does not justify the added complexity and cost in standard anterior cruciate ligament reconstructions. When it comes to preserving the native joint, non-operative management remains a highly viable first line, even for structural pathologies like femoroacetabular impingement syndrome. A prospective cohort study in the American Journal of Sports Medicine evaluated a standardized 10-minute pelvic tilt-focused home exercise program, known as HipFit10, performed at least 4 times per week for 6 months. Out of 214 enrolled patients, 78% successfully avoided surgery at the 6-month mark. Patients experienced significant improvements in their International Hip Outcome Tool scores, with over half achieving the minimal clinically important difference by 6 months. This highlights that a dedicated biomechanically targeted home exercise program is a safe, effective, and highly accessible alternative to early surgical intervention. For elderly patients with complex fractures, however, the choice between conservative management and surgical intervention is often more clear-cut in the long term. The Journal of Shoulder and Elbow Surgery published long-term follow-up data from a randomized clinical trial comparing reverse shoulder arthroplasty to non-operative treatment for displaced 3 or 4-part proximal humerus fractures in patients aged 80 and older. At an average follow-up of over 7 years, patients treated with reverse shoulder arthroplasty achieved significantly better functional outcomes with a mean constant score of 62 compared to 51 in the non-operative group. Although all conservatively managed fractures eventually healed, they did so in malposition, leading to a progressive deterioration of shoulder function over time. This long-term evidence strongly supports primary reverse shoulder arthroplasty as the preferred treatment for displaced proximal humerus fractures in this elderly cohort. If you only have time for one paper this week, make it the 20-year randomized controlled trial on patellar resurfacing. This large-scale study provides the longest-term high-level evidence to date on a classic orthopedic debate, demonstrating that, while primary clinical outcomes are similar, patellar resurfacing offers superior quality-adjusted life years and excellent cost-effectiveness over 2 decades, firmly establishing it as the preferred standard of care. Here are the key takeaways from this week in orthopedics. First, a tibia-first gap-balanced patient-specific alignment strategy in robotic-assisted total knee arthroplasty provides vastly superior ligament balance compared to mechanical, kinematic, or functional alignment. Second, patellar resurfacing during primary total knee replacement is highly cost-effective and provides better long-term quality-adjusted life years over 20 years, supporting its routine use. Third, patients who sustain a periprosthetic femoral fracture within 30 days of primary total hip arthroplasty are at extreme risk for complications, with a 2-year reoperation-free survivorship of less than 50%. Fourth, Biological augmentation of anterior cruciate ligament reconstruction with platelet-rich plasma or bone marrow aspirate concentrate does not improve clinical or radiological outcomes at 2 years. And finally, preoperative use of glucagon-like peptide-1 receptor agonists in obese patients undergoing rotator cuff repair is safe and associated with lower rates of revision and re-tears. That's your roundup for this week in orthopedics. The full transcript and references are available on the episode page in your Audio Scholar library. This is an AI-curated summary. For clinical decisions, always consult primary sources and current guidelines. See you next week. If this weekly briefing is useful, follow the show in your podcast app so new episodes arrive automatically. And for audio briefings on your own clinical questions and papers, visit audioscholar.cc. This is an automated summary generated by artificial intelligence, which can make mistakes. Always review the original source materials.